Thanks. We're finding out tonight that Hispanics in Colorado account for a disproportionately high number of both COVID-19 cases and hospitalizations. KRDO News Channel 13's Julia Donovan spoke to healthcare advocates today about why this might be the case and what the state is doing about it.
While Hispanic people make up approximately 20% of Colorado's population, they account for around 30% of COVID patients. Advocates for local Latinos tell me the disproportionately high statistics don't surprise them.
The pandemic is really showing what we already knew, which is that our communities don't have access to health care, financial security.
We can see the snowball of how one inequity really leads to another.
Emily Cervantes with Claro and Catherine Riley with Color, two local Latino advocacy organizations, agree the cause in this disparity can be a number of things. Hispanic people are also uninsured at a disproportionate rate compared to other demographics, which means their overall health is less likely to be as good as it should be.
We have someone that has diabetes. It might not be properly managed to begin with, and COVID just exacerbates that problem.
And many Latino families often live with several generations in one home.
Since they're multi-generational households, chances are that grandma and grandpa are in the home as well, and they're at higher risk.
Emily and Catherine said there's no clear way to fix this. While public health officials have rolled out new messaging campaigns to help with language barriers, they both say they think we can all do more.
Having care and an acknowledgement of what many of our communities are going through, I think, is the first step.
They believe the only way to help Hispanic people during the pandemic is to help everyone in need.
It's really important that we, as a society, take care of our most vulnerable people.
Reporting in Colorado Springs, Julia Donovan, KRDO News Channel 13.